Good afternoon to everyone. I want to thank the generous Houstonians who have donated to the PPE drive today. And off the bat, I want to thank Project C.U.R.E. Thank you, Janet. And I want to thank Shanier, Representative Dave Wendy. Thank you. And then I want to thank the Astros Foundation, Twila. Thank you. Because quite frankly, without these organizations and persons coming together, this would not be happening. I want to thank all the volunteers. Thank you all so very, very much. Really appreciate it. And all of the people who came out and donated today, 2 box truck load of supplies, N95 masks, gowns, you name it, sanitizers. Cannot thank Houstonians enough. I mean, one thing I've found over and over again is that Houstonians, when asked, they will give, and they keep giving, and I just can't thank you enough. I certainly want to highlight Chevron, the marathon, Houston Chevron Marathon, for donating all of their gloves from the marathon. Thank them so very much for their generous contribution. The Pakistani Association Alliance for Disaster Relief, 1 pallet of supplies, N95s and sanitizers. Thank you so very much for being so very generous. Coastal Supplies, 50 gallons. Yeah, come on, to all of them. Coastal Supply for 50 gallons of sanitizer, and all of these supplies are going to our first responders, healthcare providers. So again, from the depths of my heart, on behalf of all of Houston, let me thank you all so very, very much. And now let me turn it now to Twila with the Houston Foundation. And again, they've stepped up on multiple levels because Jim has just been very, very helpful with his connection to a global supply chain of helping the medical center, helping the city to bring in needed supplies to the city of Houston. So Twila represented the Astros Foundation.
Thank you, Mayor. Thanks to everyone who came out today to help with this supply drive. Chenier, your generosity in matching the contributions to Project C.U.R.E. up to $50,000 is unprecedented. We're so excited to be great partners of yours. You know, what a great day, and part of what makes me proud to be a Houstonian are the Houstonians that step up to the plate and give back. We had 2 great examples here today that I just want to tell you a little bit about. Yesterday, one of our season ticket holders reached out and said, "Hey, I've got a young man. It's a distillery here in town, and they're making hand sanitizers, and they want to bring a pallet load of hand sanitizers by." So, University of Houston sophomore, he's somewhere around here, Juan Carlos Martinez de Dalcoa with Gulf Coast Distilleries. They brought a pallet, 576 bottles of hand sanitizer. They have produced over 100,000 gallons of hand sanitizers. Wow. Amen. Of that, they have been so generous to our city. They've contributed over $300,000 to our first responders and hospitals. Over $300,000 in hand sanitizers. That's a lot of clean hands in my book. The other one that came through today, and again, one of our investors yesterday sent me an email and said, "Hey, here's somebody you may want to talk to." And along comes Wiley Rogers with Signature Aspen. And Wiley is a sophomore at Stanford. I believe he and Juan Carlos must have gone to Episcopal together. I believe that's the connection, but they're good friends. And Juan Carlos had reached out. Anyway, you tell 2 friends, and so on and so on. Well, Wiley at Signature Aspen, they have produced over 25,000 of these little jewels. It's kind of hard to talk through, so I'm not wearing it, but they're the face mask. Houston strong, and certainly Houston proud. But they've produced over 25,000 of these. He came up from Kemah today to make a donation to our drive. They've donated 2,500 to the hospitals, the local hospitals. And so we're just so proud to have our fans, the Astros fans, so many of them have come out today to donate, to help on our efforts, but we couldn't do it without all the fabulous volunteers and the media. Your support is great in that pushing the word out. It's not too late, never too late to donate to Project C.U.R.E., and Chenier is going to match that up to $50,000. So again, Houston strong and Houston proud. Thank you.
Thanks, Twila. Now let me bring up Wendy Craven, representing C.U.R.E. Wendy.
Thank you. Thank you. Today we found out, there are people on the front lines in Houston fighting this pandemic for us and in our surrounding areas. We can't let them be out there without proper PPE. And so that is why we are here today doing what we're doing. As they have mentioned, we are here to put down a public matching opportunity, dollar for dollar, to Project C.U.R.E. And as you see on the box truck behind me, it's projectcure.org. You go to the website, you choose the C.U.R.E. Energy Match, and we will match dollar for dollar up to $50,000 this week. We are only halfway there. The last numbers we got were around 25,000 has come in so far. So no donation is too small. Please consider jumping in if you don't have PPE, but you'd like to help with this cause. Today is just one part of over $1 million commitment that C.U.R.E. has made to fighting or responding to this COVID epidemic. So we are really proud to be here. C.U.R.E.'s hometown is Houston. Those on the front line who are testing us, treating us, feeding us, are our hometown heroes. And we are really proud to be here and supporting them with this PPE drive. And we are looking forward to doing more in the future. Thank you.
Thanks, Wendy. And we're gonna make that dollar for dollar, that $50,000 match. I know with the greatest degree of certainty. I already know that's gonna happen. So let's thanks C.U.R.E. one more time. Thank you all so very, very much. And now, Janet, let me bring you up for Project C.U.R.E. You all have done this in Denver, and now you're leading it here, and the turnout has just been tremendous. I can't thank Project C.U.R.E. enough. Janet, come on, why don't you come on?
Thank you, everybody. What a privilege it is to be here on behalf of Project C.U.R.E. today. Thank you so much for our partners, for Cheniere Energy, for the Astros Foundation, for the City of Houston, for the students, future doctors and future PAs who have come out from Baylor College of Medicine and volunteered with us today. Yay! To all the supporters who have been out here. It's just about giving. It's just about reaching down into our hearts and making sure we get these supplies to those who need them. At Project C.U.R.E., we like to say we're saving the world one cargo container at a time. But right now, today, we've been saving the world one box at a time. And some of the most touching donations that have came out here today have been people with one box of gloves. A gentleman came up with one face protector. And you could tell it was well used and well loved. So to the Houston community who has come out here and been here and just stepped up, showing their appreciation for the first responders in Houston, thank you so much. Project C.U.R.E. stands ready to continue to support the City of Houston, to support our other communities in Arizona, in Illinois, in Colorado, in Philadelphia, in Kansas City, Missouri, and in Nashville, Tennessee. We are here to fight with all of you to end this COVID crisis. Please continue to support us through this wonderful C.U.R.E. grant and matching opportunity through your donations. Those of you who need us, please go to that website, projectcure.org. We want to be here for you. Thank you, Houston. Thank you, everybody who's been here today.
Thanks, Janet, and people have just been so generous. Look, Anwar Javad is making a contribution, but Mohammed Sheikh has been working with us so very, very closely. Why don't you just come on? Instead of me repeating it, why don't you make it?
Thank you, Mayor. On behalf of the Alliance for Disaster Relief, Pakistani Association in Houston, Karachi, Sister City, and all other organizations, we are grateful to be part of all the drive, all the efforts the city is making in COVID-19 relief efforts. On behalf of our Chief Patron, Mr. Syed Javed Anwar, I would like to announce $10,000 donation to the Mayor, which organization he wants to donate. I'll make sure that within 2 days, he'll get the donation. Thank you.
Thank you, Mohammed. I look again, just a big, huge thanks on behalf of so many. Susan Christian to Special Events, thank you as well for your efforts and your entire team as well. Now, let me stop you. If you have any questions to any of these individuals, this is a good time to ask those questions to any of these persons here. Hello.
the decision that Judge Hidalgo.
Oh, this is just for the drive for right now. This is part one. Okay. All right. Thank you all so very, very much. Thank you all. All right, we're now bringing us.
Thank you very much.
Oh, thank you, Consul General.
You have always been at the front. I'm so glad having it. I made a point that I'll come down and congratulate you.
I appreciate that so very much. Thank you, Consul General. I do want to acknowledge the Consul General of Pakistan. So thank you so very, very much for being here. Thank you so much. Give it up to the Consul General of Pakistan. Okay. And this is the part of the daily briefings that we give as it relates to COVID-19. Today, the Houston Health is reporting 60 new cases. There are 60 new cases of COVID-19, bringing the total case count in the city of Houston now to 1,380. So 60 new cases. As you know, yesterday we reported 175. Then the day before was 402. Today we are reporting 60 new cases. The total number of deaths in our city of Houston, based on the information that I currently have, is 12. And so that number now goes up to 12. Yesterday it was 11. And as information is obtained, because some of these, for example, the death that's occurring today, that's being reported today, occurred on April the 5th of 2020. The one new death that is being reported today, which brings our number to 12, is an African-American woman in her 60s with underlying health conditions who passed away on April the 5th. That means that the total number of deaths of people who have died in the city of Houston is 12, and 8 of the 12 happen to be African-American, 2 Hispanic and 2 Caucasians, all with underlying health issues such as diabetes or hypertension. And that's why it's so very, very important to provide education in all parts of our community, but especially communities of color. Education, education, education. For all of us, it's very important to continue to stay at home. If you're not working with essential employees, social distancing becomes so critically important. So I want to emphasize all of that. And then I want to give a report, something we hadn't done in the past. And so let me, for those in the media, I got a few copies. Since we don't have the board in front, behind me, you can kind of go along. And this is information that both the county judge and I have asked for from our health care, from our hospitals. For example, this is coming from the Texas Medical Center. The number of ICU beds, for example, this is a report as of April the 7th. The number of ICU beds, if you look at the chart, let me put on my glasses. You will see on this first chart, 33% of the ICU beds currently occupied for non-COVID-19. That number is 487. 25% currently occupied COVID beds. That number is 368. And then 42% of ICU beds available without the surge. That number is 607. And then if you factor in that second phase, to the extent a surge is needed, then that shows you the number of ICU beds that they can expand to, which is 1,370. The delta is being 1,450. So as you can see, as it relates to their ICU beds, as of today, as of April the 7th, I should say, they are within their capacity, their base capacity, as it relates to ICU beds today. On the second page, this pertains to the ventilators. And TMC, this covers 9 counties. The ventilators, the TMC ventilators across the 9 greater Houston counties, as you can see, 15% currently occupied non-COVID-19, 361. 6% currently occupied COVID-19, that number is 136. 79% of the ventilators available without the surge, and you see that number being right at 1855. And then if they have to have the surge, there's room to go up. So again, even as it relates to ventilators today, they're within their base capacity. Expected TMC system equipment, to give you some idea on the PPEs, with maximum social distancing. So with maximum social distancing, they are good, can handle N95, respiratory masks, surgical masks, eye protection gowns, gloves, and ventilators. That's on maximum social distancing. Right now, I would say we're about in that moderate phase. It's not the maximum, because the maximum literally means you're just shutting everything down. We're in that moderate phase. They can provide N95 respiratory masks, but if you see the notation, it's shortage, but they have a path to fill for N95 masks, just like what we are doing today, for example. The surgical face masks and moderate social distancing, they're fine. Eye protection, there's a shortage with the path to fill. Gowns, gloves, they're fine. That the ventilators, may require some support. That's on the moderate social distancing. And with minimum social distancing, you see there's a need for almost everything with the exception of gloves. So that's why it's very important for us to continue to engage in social distancing, the stay home, work safe order. And then with respect to the TMC current COVID-19 stats as it relates to their patients, the total number of people who have been hospitalized in the TMC hospital system, 9 counties, 1,086. The number that's currently hospitalized is 747. The number that's been discharged up to this point is 289, 50 deaths, and in that number, 12 are coming from the city of Houston that's being reported today. Just kind of wanted to provide you a little bit more granular information as we kind of go through it, instead of just giving you just the number of deaths and the number of new cases that are coming in, and hopefully that will provide some additional information for you. Now, at this time, let me stop and let me bring up first Chief Pena from the Fire Department.
Thank you, Mayor. I'd like to first start by thanking Project C.U.R.E, C.U.R.E, and the Astros Foundation as well for the incredible work that they've done here to collect all these much-needed resources. I want to begin my report by giving you a quick update on our captain that's been hospitalized with COVID-19. He is doing well. He is still in ICU, but he's doing well, not intubated, which is a positive sign. They're monitoring his O2 sats, and we're hoping for a full recovery. As far as our the number of positive firefighters that we've had is 21 total cumulative. Of those, 10 have since come back have recovered and come back to work. We've tested 78 total, and we're still waiting on 36 results. In quarantine, we have at the moment, and this is a positive sign, I'm hoping that this is a trend that continues and we begin to level off the number of people in quarantine. But today we have 152. As you recall, yesterday we had 165, and the day before we had 220. So we're getting a significant number of firefighters returning back to work. We haven't seen the number being replaced by new ones having to be quarantined. That's as a result of the incredible work that these guys are doing, these guys and gals are doing in ensuring that they're wearing their protective equipment and being more cautious as they approach each scene. So we're hoping that these trends continue. As far as the enforcement on the stay-home order, in the last 24 hours, we've had 101 responses to complaints. We've managed to get voluntary compliance on each one of those, and that's a positive. In the since the stay-home order began, we've issued 1 citation, and we've had hundreds of cases that we've gone out and inspected, and the great majority, almost all of them, have been resolved through voluntary compliance, and that's the goal: education and to gain voluntary compliance, and we're hoping to maintain that trend. Thank you.
Chief Slinkard, representing Chief Osvaldo for today.
Okay, good afternoon. Thank you, Mayor. Thank you, Chief Pena, Chief Bunick, and Dr. Purse for all your partnerships. This is just such a great example of Houston Strong. with these private partnerships coming together with public that's out there every day on the front line in the public sector working for our citizens, we cannot do it alone. And this is just a great example of how strong and how great Houston is when we work together. So let me give you an update from the Houston Police Department. First, let me tell you that our workforce is still strong, and our workforce is still out there every single day working hard and answering calls for service throughout the city. Right now in quarantine, we have a total of 119 personnel. I see that as a positive sign right now because at one time that was well over 200. And some of that was due to travel restrictions and things about coming back to work, if you've been on international travel. But that number is steadily coming down, which is a positive sign. That's 88 classified individuals or sworn police officers and 31 civilians. Regarding our testing numbers and those results, we've had a total of 135 tested. That includes 131 officers and 4 civilians. Of the 131 officers tested, 27 have come back as positive. As you recall, yesterday that was 24, so that's an increase of 3. 27 have come back positive, 54 are negative, and 50 are pending results still. Of the civilians tested, those 4 that I mentioned, 1 has come back negative and 3 are pending. Return to duty after previously testing positive for COVID-19, we have 5 that have returned to duty. I would ask that you continue your thoughts and prayers for our officer who has been in ICU now for quite some time. The chief mentioned yesterday that the condition has not worsened, but it hasn't necessarily improved to the degree that we would like to see. So please keep your thoughts and prayers going forward for that family and for that officer. That's all I have, Mayor. Thank you.
Thank you. And we're going to continue to pray for that officer. Let me bring on Dr. Pearce. And I know one of the questions that you might want to ask Dr. Pearce, and I'll ask it for you, is this virus seasonal? If so, can it withstand Houston heat?
Mayor. So, Mayor, I don't know if it's seasonal or not. But if there's any place that's going to find out, it's going to be Houston. And let's hope that it is sensitive to the weather. The mayor reported our numbers today, and he also indicated and showed how our numbers over the last 3 days of new cases has gone down. Both HPD and HFD have brought us some good news. That does not mean that the virus has left. What that means is that we are all, as a community, doing an increasingly better job of social distancing and keeping our families and our friends safe. One thing to keep in mind in public health, our research has shown over the years that when you put an intervention into a community to try and slow down a virus, it takes about 2 weeks before you see the impact of it. And I think that's what we're seeing now, is the impact of everyone's hard work. Please don't misunderstand that to think that the virus has left town. It has not left town. And so we need to continue to be vigilant. Today, there's another death, another tragic death. And so that should be a stark reminder that we are still in this game, and we can expect to continue to be in it for some time. To that point, I want to remind folks again, I'm probably starting to sound like a bit of a broken record, but the mask that you wear, so many of us, I'm so glad to see that so many of us are wearing masks here today. That isn't to protect you, that's to protect the person next to you. Social distancing is a separate strategy. Keeping 6 feet at least from the folks next to you is a separate strategy. They work in concert with each other, and the same thing with testing. That is yet a third way that we are working to keep our community safe, but no one of them replaces the other. And that if we continue to do what we're doing, hopefully we'll continue to see our numbers improve. But that's not in spite of what we're doing, it is because of what we're doing. Thank you.
Chief Bunick, Office of Emergency Management.
Thank you, Mayor, for your leadership and your guidance during this crisis, and for also wearing the face mask in public, just to show everybody it's just another step, the many steps that you've implemented or put in place to keep everybody safe. Thank you, Project C.U.R.E, C.U.R.E, and the Astros Foundation for allowing us to accumulate some more personal protective equipment. This is stuff that's needed for our first responders, our police officers, our firefighters, our health department employees, and people that are on the front lines. The city is going through the purchasing process. I'd like to thank our financial director, Tantra Emo, Jerry Adams, and their team for all the hard work they're doing 24/7. But it's really the donations like this that we received today and the donations that we received the last 3 weeks that are keeping our frontline first responders protected on a daily basis. Through donations today, we're also able to get this PPE out to some of the other essential workers for the city, including our solid waste, our public works, our Houston Emergency Center people. So I just want to thank everybody very much for their generosity.
Thank you, Chief. We'll take any questions now.
Hey, Mayor, good afternoon. Good afternoon, everyone. Hope everyone's nice and healthy under the circumstances. First question from the pool here is, what is your response, Mayor, of the decision that Judge Hidalgo will close the county parks?
Certainly, she made the decision to close the county parks. The city of Houston, as I said the other day, our parks the city parks are remaining open. But I've indicated that if you go to a park and it's crowded, please go to another one. If you can't engage in social distancing, go to another. We have over 300 parks. Most of them are localized neighborhood parks. And so, but the park rangers have the instructions that if they go to a park and it's crowded, people are not engaging in social distancing, they have the prerogative on the spot to shut it down.
Follow up on that is, you mentioned obviously that you have no desire to shut down the parks. You indicated that you're going to have the rangers providing that advice there. Are there any plans now to close any of the city parks?
There are no plans right now to close the city parks, but again, I reserve the judgment to assess on a daily basis. We are encouraging people, number one, to engage in social distancing. That's a must. I've said to people that we're going to be very intentional this month and that don't want the parks crowded. So if you go to a park that you can't engage in social distancing, go to another one. If that one's where you can't engage in social distancing, go to another one. But the park rangers, the city park rangers, if they go to a park and people are not engaged in social distancing, they have the authority. I've given them the authority to shut the park down if necessary.
There was a news conference earlier today with Governor Abbott, and I guess Vice President Pence also made some comments with regards to providing assistance towards the city of Houston and the area, citing that this is an area that they're starting to see a little bit of a surge. What is your comments to that, sir, your reaction?
Well, they made the decision on yesterday to continue the federal health partners and the equipment through April the 30th for both of our testing sites in the city of Houston, so that's a plus. And so we look forward to working with all of our stakeholders, but they are not pulling out their federal health partners. They're not putting us on a 75-25 cost share with regards to our testing sites. And certainly what I would do, I would certainly ask for additional support in terms of PPEs to expand testing sites within the city of Houston. We need to really focus on communities and neighborhoods that have been underserved, under-resourced, where there are a lot of people who can't access, for example, the two testing sites right now. We need to get actually into the neighborhoods. And as you can see, with respect to the number of people who have died, the number being 12 that's being reported today, 8 of those 12 are African Americans with underlying health conditions. So we really need to get into many of these communities of color, and do a lot more testing. The testing has not been nearly as robust as I would have liked it.
If you need a wipe or anything, Mayor, because it's hot outside, I get it. I'm going to get this other question here in a moment. Okay, got it. There's been some early indications out of Washington today that there might be potential that the country might be getting back to work sooner than anticipated. There's some reports out, some comments. What are your thoughts on that potential avenue opening up?
Well, I think whether that will be guided by the facts, the science, the advice that we're getting from the medical community. We're all anxious to get back to some degree of normalcy. We're all anxious to do that, but we want to do it in a very prudent and wise fashion. What we don't want to do is stop engaging in social distancing, and then the numbers just spike up higher than what they're doing today. So the stay home, work safe order remains in effect. Social distancing will be required throughout the entire month of April, and we all just need to be very, very focused, very, very focused. As you see, with the numbers coming from TMC, as long as we are engaging at least a moderate form of social distancing, then we can handle the caseload. It can be done within the healthcare hospital delivery system ability to handle the cases that are coming in. If we engage in minimum social distancing, then the numbers are going to spike and we're going to overwhelm the health system. So let's focus the entire month of April, social distancing, stay home unless you're working for an essential business.
We're outside of left field here. There's been talk about baseball returning in Arizona. That means the Astros, as well as all the other teams, would be playing in Arizona to kind of get the season going. It's only fitting because we're at Minute Maid Park to get your thoughts with regards to that potential.
Well, right now, the season will come back. I think we're all anxious to start playing ball again. But for right now, what I'm anxious is making sure that the numbers are going down, that we get on the other side of the peak and we stay down. I don't want to see another life being lost to coronavirus. I don't want to see another person struck or infected because of the coronavirus. I want to make sure that when the fans are in the stands, they're healthy, they're strong, and that they can cheer without infecting someone right next to them. That's my primary focus.
Mayor, lastly, you indicated on Monday that you'd brought this up yourself, that there have been some challenges, obviously, with getting the reports out with regard to positive tests. It is not an easy process. This is very complex.
Right.
Can we get your thoughts with regards to the death process as well? Because we've been able to identify one person. Your office, to their credit, they're investigating it to find it further. But how challenging has it been on the death front to even identify people who have died from this virus?
Well, I'm sure that there was a period of time when people were not even testing for COVID-19. Now, as we know more, I think the hospitals are testing for more. And so these numbers, to some degree, are fluid. And I will tell you, there are a number of cases in the hospital that are confirmed COVID-19. There are some that, what do you call it,
PUIs, persons under investigation.
Persons under investigation. So there are a number of cases that are under investigation, but that haven't been confirmed. There are people who have been tested, and the tests have come back positive. There are people who have been tested, and they're waiting on their results. So sometimes the numbers can lag a little bit. But I will tell you, from my point of view, and as the mayor of the city of Houston, when I look at the numbers of people who have died in the United States, and that number being more than 13,000, and the number for the city of Houston, for example, is, let's say 12 today, could be 13, could be more than that, could be 20, I don't know. But the reality is, we only represent a small percentage of that overall count. I want to keep it that way. And in order for that to stay that way, people need to stay home unless you're working at an essential business. You need to engage in social distancing because, quite frankly, your destiny is in your hands. If you take it seriously, then you're going to do the right things. I will tell you, it is not comfortable at all to be standing up before you in 90-degree weather with this mask on and sweating and hot in Houston's weather. But if I have to stand here for several hours to get the message across for people to stay home and to engage in social distancing, then the discomfort is worth it. And so I am asking people to experience the discomfort for now in order to enjoy the comforts of life in the city of Houston later. And that's why even this weekend, as people get prepared for Passover, as people get prepared for the Easter weekend, I want you to stay home. I don't want you to crowd the parks. I don't want you to be out there with Easter egg hunts with your children all together. I don't want that. And I don't want the government, I don't want us to be heavy-handed. We shouldn't have to tell people not to be in a park that's crowded where you can't engage in social distancing. We shouldn't have to tell you that. Police officers shouldn't have to come and tell you no. But if we must, we must. But I don't think that as a governmental leader, that I ought to be able to dictate everything you do as if you don't have a mind of your own. So if you don't want to think about yourself, think about your family member, your friend, or somebody that you know. So this weekend, a tough weekend for people of faith, I'm asking for your faith to be practiced in the comfort and the safety of your home or your own space. Okay? Otherwise, yes, tomorrow or Friday, on Good Friday, I could come before this mic and say to you, I'm shutting the parks down. And if I have to do that, I will. But I think Houstonians, the people who gave these supplies, I think people care enough that if you ask them not to do something, they're not going to do it. That's my hope. That's my prayer. And now we'll see. Okay.
Mayor, on that note, the health department, maybe you or Dr. Persky answered, the health department has said the racial breakdown of the city of Houston deaths. Have you guys talked to your partners in the county and surrounding counties about also providing the epidemiological data, because it's so important to sort of analyze and see? Because I think that has not been an easy data point to get from every health.
And Maya, I can tell you the answer is yes. Both the county judge and I have talked about it extensively. We've talked about it with the Texas Medical Center and with others. We want to get this information as granular as possible. We also, with the help of the medical center, the hospitals, Dr. Purse, Dr. Shaw, Steve Williams, the medical director, is that we're in the process of putting together a heat map that will also kind of pinpoint where in the city of Houston, for example, these persons live, so we can be more targeted and strategic in directing our strategies. But it is important, just like it's important to know their ethnic identity. Okay, that's important. Their gender affiliation, that's important. Age, all of those elements are critically important. So the answer is yes, and we're going to do our best to try to provide this information in more real time, so that everybody can kind of look at it and see that. Well, let me back up. There was a time when African Americans were saying that the coronavirus, African Americans couldn't get it. At the very beginning, I even heard it. African Americans can't get the coronavirus. That's something that we have within us that it won't hit us. And for a moment, I kind of believed it for a moment. I said, thank you, God. Then God said, hold up. Not the case. This is an equal opportunity virus. And it preys much so on vulnerable communities. And if you have pre-existing illnesses like hypertension or diabetes, it will come after you even so. So no one is immune. And it's important to provide this information and to de-aggregate the information so people can see. And as of today in the city of Houston, yes, of the 12 cases that are being reported, 8 of the 12 are African Americans. And all 12 suffer from underlying medical conditions.
You guys don't have information on the county, I assume? So we asked the county already, and they didn't have any.
Not yet.
Okay.
But it's being put together.
And then can you speak to the more granular information, the reluctance at this point, because the quadrant system currently doesn't really tell us anything.
Say it one more time.
The quadrants, they're doing cases like Northwest, Northeast. I mean, it's a big county. It doesn't really, and there's some pressure because other counties in San Antonio and Montgomery County are doing zip codes. So sort of kind of tell us what kind of granular level we can expect, because I think
we're talking about zip codes.
Okay, so you are considering releasing zip codes.
Yes. Now that of course that our numbers are like 1,300, I think it's more instructive. If we provided that information at the very beginning, where it was only, let's say, a few hundred, it would have been kind of hard to read anything from it. And even now, let me just, even before we provide that information, let me put a cautionary note. It's based upon, for example, the people who have been tested. And so it may appear to be more cases maybe lining up in one geographical area. That doesn't necessarily mean that it's not everywhere, okay? But regardless of those caveats, it is information that we would like to provide heat maps so people can get a sense of where the cases are, and then it will help policymakers like myself and the county judge to target our specific strategies based on the information that we're seeing.
And do you guys have any, and does maybe Dr. Purse can better answer, do you have any idea when any faster testing or more accessible testing will be here? Because I guess the federal testing, the structure is not going to change, right? You're going to have 500 capacity, that's not going to increase. You haven't had, like, they're not going to send you like 200 more tests a day or anything?
Let me back up and bring up Dr. Purse. It'll give me an opportunity to fix my mask and to be more presentable in the next segment.
Thank you, Mayor. So in terms of testing, you're right in that the federally supported sites we're basically going to be, for now it is our understanding that we will continue to function as we have been. We are trying to negotiate with them to see if there will be any variability in that. And that's not just a local issue, that's in all their sites across the nation. As this thing evolves, we need to evolve with our testing and surveillance as well. We are looking at other options to expand testing throughout the community, but those plans are sort of in their infancy. We're facing the same struggles we've had all along, getting PPE, getting laboratory testing. hopefully we'll get laboratory testing with a rapid turnaround. And so there are a number of factors that come into that. But we are having those discussions. And I want to point out that the mayor is becoming quite the epidemiologist, as he points out that one of the things that biases our current information is that where the testing sites have been available, because people tend to go to places to be tested which are near their home, and if it's too far, they just don't go. And so whatever our maps that are going to come out, whatever they're going to show, they need to be taken with a grain of salt, and that they are heavily influenced by where the locations are of the testing sites. The other thing that I would add on to that is that they're also biased by the time in the evolution of this whole thing. So I've used the analogy before that when we look at the map, it's like looking at a single frame in the movie. And it will tell you what the facts were for that day when we did it, when we produced the map. But a week later, the map is going to look different. By definition, it will look different. And the biggest thing that we worry about when we put out maps like that is not where it shows the hot area, it's where it shows cold areas. And people misinterpret that to think that they don't have an issue there. And it's only a matter of time, generally, before that area will have an issue. And so we don't want people dropping their guard because the map suggests that they didn't have a big problem there. It may be because the time just hasn't come yet. And it may also be because people in that neighborhood just haven't gone and gotten tested yet. And so like any other piece of medical data, you need to put it in context.
Is there any thought about maybe, I don't know, some sort of registry or something where there's a lot of private testing, but I think people are sort of like, well, who do I call? You know, is there some sort of list like the private folks can just, I mean, or something where they can at least get a clue about other accessible options?
Yeah, so we have the list of the testing centers that we know of. And I believe the mayor mentioned earlier about how some of the Walgreens and CVS's may start up testing soon. And as that occurs, we'll hopefully get those. We only know about the ones that we know about. So we can make that information available, sure.
We're just going to take a few more questions. Everybody.
And let me say, some people have asked, okay, at what point, Mayor, when you all may open up, for example, the city and things of that nature. That's in part is going to be predicated on the testing. So we need the testing to become a lot more robust. I've asked Director Williams and Dr. Peirce, for example, to be creative and innovative to find ways to extend our testing capabilities, especially in communities where people are having a difficult time because of access, the inability to access them to get into the communities. So areas like, for example, Sunnyside. I know Senator Boris Miles has been pushing hard for additional testing sites in his area. Councilmember Robert Gallegos, Councilmember Carlos Cisneros have been pushing for testing sites in the East End. And so I've asked them to make those two areas priorities in getting it done. We are going to need, for example, the state's help in additional PPEs in order to get that done. But we need more testing that will put us in a better position to measure the degree of the spread and how extensive it is, and hopefully we can reach the point where we reach the peak and our numbers will go down. And once they start going down, we need to continue to engage in social distancing to keep the numbers down. Okay.
Mayor, a question from Channel 11 that they just informed me of. They wanted to find out from you personally, do you plan to change your manner of behavior moving forward in terms of this weekend and celebrating Easter, practicing the social distancing? Do you plan to switch anything up with the way you interact with other people?
Yes, I mean, this weekend would be one of the busiest weekends for me. For those of you who have been following me for 5 years since I've been mayor, you know on Good Friday, I am out all day. The Easter egg hunt at a number of different places, at several parks. On Friday is a full day for me. On Saturday, for example, would be my family fun day, the second Saturday in April, with about 15,000 people at an event that I have sponsored for the last 13 years. This is the first time in 13 years that's not going to take place, and that's in Acres Home, and it goes generally from 12 until 6 o'clock for 15,000 people. That has been postponed. On Sunday, since I can remember, I've been a member of my church for some 28 years. I would be at Brook Hollow, Church Without Walls, on Sunday morning for church with Pastor Ralph D. West. And then after that, my family would come to my house for dinner, and we haven't missed that in a number of years. All of those events are changing, not taking place. And there have been times when I've gone to Seder with Jewish friends and for their Passover events. and I will miss being with those families. So this weekend, this whole week has changed dramatically for me. However, it is what it is. And in order to keep people safe, and in order to demonstrate to other people that these are sacrifices that we're having to make, the whole week for me has totally changed. Okay? Anything else? Let me just say, if the weather gets over 70 degrees, you can't go to the park. That is a joke. Okay. But you can go if you can't social distance. Okay. Thank you all to all the volunteers. Thank you to C.U.R.E, to the Astros Foundation, to Project C.U.R.E. Thank all of you for the supplies. We very much appreciate it. Thank you very, very much.